Welcome back. We are within the last hour of Weekend Express, and earlier, as I promised, we'll be taking a look at the conversation of breast lumps. Let me just say that it's very important, so we're going to have our phone lines at the bottom of your screen, so you at home who is watching can participate, call in or tweet us directly at KTN News at Zindzi_K for the doctor who is with us here on set. Let me introduce Dr. Varun. He is a general surgeon, and he'll help us and take us through this conversation. Dr. thank you so much for your time.
Hi, good morning.
So let's begin with a definition of what a breast lump is.
A breast lump is an abnormal mass which is felt in a normal or abnormal person. It's a lump which is felt obviously to a female, and even it can happen in males. The most important thing is it cannot occur at any age.
Wow.
Okay, it's like even a 15-year-old female can have a lump, even a newborn can have a lump of the breast, and an elderly male or female can have a lump. So
it doesn't have any age restriction?
No, lump can occur in any age, invariably male or female.
But how do I know, especially for women? Because we have a lot of, should I say, organs within the breast side. So how do I know that this lump is an abnormal lump vis-a-vis the other elements within my breast?
Okay, usually the patient feels that there's something abnormal in their breast, especially females, those who do self-examination. They feel that there's some abnormal sensation of something moving around in the breast, and that's how they come to know that there's a lump.
Is it true that if it's a bit more hard than other parts of your breast?
Sometimes it may be soft, sometimes it may be hard, and if it is hard, we have to be very careful. So it can be a breast cancer.
How do I go about personal screening? Because I've read somewhere that the best time to do it is when you're showering. Is that true? Help us demystify this.
Usually, it's very common to notice a breast lump when they shower. And sometimes, few females, they used to do self-examination routinely, because those who are aware of breast cancer, they are keen on their examination, and that brings to their notice, especially for example, if there is a family member who has breast cancer before, a female in the family, in the same family, can definitely will be more keen about the lumps in the breast, because they know the importance. So automatically, what happens, each and every time when they feel their breast, they try to search, is there any lumps? So in that way, they come to know. Usually, it happens only where they take bath.
Okay, and the best time in the month, especially for women, to perhaps do a self-examination before or after my period?
No, it doesn't depend upon the periods. And there's especially one condition where it won't be a hard mass, definitely. It will be like that's something called as fibrocystic disease. So, and the most important thing in that kind of breast lump is it will be painful. So any painful lump is harmless.
And are all lumps cancerous lumps?
Yeah, this is most important question which the females has. And it's very common too. So any lumps which they feel like they come with some kind of lumps, and they think, most of the females, they think that it's cancerous. But usually what happens, it is not all the lumps are cancerous, and the painful lumps are definitely or very unlikely to be cancerous. And any lump which is painless, we have to be very serious. And that is where the breast cancer stays. The breast cancer lumps are 90% painless. And it's very risky too.
Wait, breast cancer lumps are 90% painless?
Yes.
So then how do I know?
So
when I'm doing my self-examination?
Yes, when you do the self-examination, or sometimes suddenly you may be doing something and you may find there's a lump moving here and there. So if you notice that it is not painful, definitely you have to seek medical attention immediately.
And if it's painful?
Usually pain brings the patient to the doctor invariably. If there is a pain, definitely they'll come to the doctor to seek advice. And if it is painful, mostly it is because of some infection, it's because of some some inflammatory pathology, but never, mostly it is not cancerous. And usually I used to say to my patients, if it is painful, be relaxed till it may get cured easily. But if it is painless, you have to be very serious.
All right, Dr. Hari, before we can even come to the treatments, do we know what causes breast lumps?
Yeah, there are many risk factors. The most important risk factor is the race, age. Age is the most important risk factor. For example, the most common age group are elderly age group, more than 50s. Any lumps more than 50s, regardless of pain, without pain, anything, please seek medical attention immediately.
All right.
And any lumps, and the common age group is from 30 to more than 30. And as the age increases, the lumps are more, the lumps can be cancerous.
Okay, talk us through the risk factors of cancer of breasts. Yeah.
Risk factors, apart from age, I would like to say the most important thing is the amount of female hormones the breast gets exposed to. For example, the most important hormone is estrogen. For example, if a female gets her periods early in her life, for example, if a female gets her first periods by the age of 12 or 13, and she gets her menopause at the late age, and this time duration, the estrogen hormone, it's a female hormone which gets exposed, the breast gets exposed to the estrogen for a long period of time. And the patients, the females, those who don't breastfeed, are more prone for breast cancer.
But Dr. Varun, especially in this day and age, we have young girls who start their period even at the age of 9.
Yeah.
Yeah.
So in that situation,
is that lifestyle?
It's not the issue. It's not the lifestyle. Actually, it's genetic based. It's not the lifestyle. And another thing is, few females, they avoid breastfeeding. And breastfeeding is very good for breast cancer. For example, if a female breastfeeds for more than 2 years, 3 years, her breast is not exposed to this hormone, and it's very healthy for her to avoid breast cancer at the later age.
All right. Just also an encouragement to our viewers. So, Tommy, if you're just joining us, if you're just joining this conversation, we're having a talk about breast lumps. Again, our phone lines, I can see them are at the bottom of your screen. Please feel free to call in and ask any questions or even a comment on the conversation that we're having here in studio. All right. So, Dr. Varun, my next question would be, what tests are done to check?
So, usually, any lump breast.
Okay.
If they seek medical attention, the doctor examines first. So they call it as triple assessment. What is triple assessment?
Triple.
So the doctor examines and comes to a conclusion whether it is a benign or harmless lump, or is it a cancer lump, and then they go for imaging. So imaging can be in any form. Like it can be an ultrasound, or it can be a mammogram, or it can be an MRI. So these are the three modalities of investigation tests which can image the breast lump. And next comes the tissue. Tissue means like we take some cells out of the lumps and we test. For example, the clinician or the doctor may say that it doesn't seem to be like cancer, and the imaging may show that it resembles like a cancer. But finally, when it comes to the tissue test, so the tissue test says it can confirm the diagnosis. What is it exactly? And regarding mammogram, I think many of the females will be knowing about what is mammogram. And mammogram is a double-edged sword. Like, for example, the mammogram itself is an X-ray based imaging. So any X-ray is harmful, for example, especially to a breast. Okay, so what we advise is, usually young females, it's better to avoid mammogram rather than they can go for ultrasound. And mammogram it's usually advised after 30 or 35 years of age because the breast is exposed to radiation, and we don't advise frequent mammogram. And when we combine all these imaging like ultrasound with mammogram and tissue diagnosis, so we come to a perfect conclusion what that lump is and whether it is cancerous or non-cancerous, and we go ahead with the treatment options.
You know, you've given and you've really put down the triple stages, and what I've also understood from that is that a misdiagnosis can happen.
No, that's why we call it as triple assessment. A clinician assesses, the imaging gives some report, and the final conclusion depends upon the tissue. So when it comes to tissue analysis, there are two methods of tissue analysis. They call it as FNA. What is FNA? FNA is we put a needle and take some cells and we examine whether it is cancer or not.
All right.
Okay.
So I'm told we have a call. I'd love to talk to Sylvan. You are calling all the way from Carbonet, Sylvan. Good morning. Thank you so much for watching KTN News. Perhaps your comment or your question towards the conversation here in studio?
Yes, good morning, Zindzi.
Good morning.
Before I ask my question, I wanted to say thank you so much for a good job. Na kesho Monday msalimie Mike. You have been doing a very, very nice job. Na mwambia Mike aendelee na mambo ya mazoezi very well. I've gained a lot from KTN.
Asante sana, and thank you for always watching.
Yes, so particularly swali nataka niulize daktari. In my village, kuna mama akifungua mtoto, especially when she has 1 month to 3 months.
She has what?
Sasa zile ananyonyesha mtoto. Na mtoto bado ni mdogo akiwa na mwezi 1, 2 to 3. Na anakuwa na saa zingine titi na fura. Na anakuwa na hiyo problem ya inaanza kufura na kuumwa sana. Sasa kuna kitu wanasema hawaendi hospitali, kuna dawa ya kienyeji. What was the problem? Kwa sababu mama anasemanga mtoto asaila ananyonyesha, sijui inasema nini kwa Kiswahili, I don't know say in Kiswahili, but most problem inakuanga saa zile mtoto akiwa mdogo. Lakini hawaendi hospitali, wanaogopa.
Okay.
Yeah, I have seen na mpaka akiwekwa dawa fulani inaanza usafi.
All right, so Sylvan, if I've gotten your question, it's are you still on the line, Sylvan?
Yes.
All right, please bring down for me your question in perhaps a sentence now, clearly.
Nilikuwa nasema in our village.
Yes.
Nimeona wamama wawili.
Yes.
Painless amekifungua hapo na mtoto kama ni mwezi 2, 3. Saa zingine titi inafura. Na akifura,
yes,
anaumwa sana.
All right, okay. I've gotten your question. All right, thank you. Yes. We're going to answer it right now. We're going to answer it in just a bit, Sylvan, so keep watching. But right now, let me also talk to Florence. Florence, good morning. What is your comment?
Yes, I'm calling about the lumps.
Yes. Go ahead.
Okay. I wanted to say that I have a lump under my left armpit.
You had a lump under your left breast?
Yes. No, under my armpit.
Oh, under your armpits, yes.
Yes, my left armpit is hard. It just grows, but it's not painful. I never realize it unless I'm showering.
Okay.
And it doesn't move.
Okay.
And then my breasts are full of little lumps that are quite painful. Yes.
Okay, thank you, Florence. Let me direct that question to Dr. All right, so Dr. we have two questions. One, Sylvan was talking about how there are two women in his village. One woman had just given birth, but her breast still seemed to always get swollen, even after pregnancy. And I think, if I'm not wrong, he said even after 3 months after that pregnancy. Is that something that perhaps they should be worried about?
Okay, regarding any female, after giving birth, and if it is if a breast is swollen, there are few conditions which are related to lactation. That means breastfeeding. First thing is, if the breastfeeding is not done, there is a chance for swollen breast. Second thing is, if she is breastfeeding and if she has other signs like what I said already, if she has pain, fever, it could be because of breast abscess. There are more chances of breast abscess in a female who's giving birth, and after giving birth, when she's breastfeeding, there's a chances of infection to her breast itself. That's called as breast abscess or mastitis.
Okay.
So if it is not of these conditions, there can be stasis of milk in a breast, which can give an appearance of breast swollen for a long time.
Okay.
So in this scenario, definitely we can say an imaging will be better and a clinical examination will be better.
All right.
So the imaging simple ultrasound of the breast can show whether it is a cyst or it's just a stasis of milk, or just it's an infection which causes
so you'd advise a simple imaging?
Yeah, just simple imaging.
Okay.
That's better.
Okay, so Florence question. Florence, for her, she has a lump on the left side under her armpit. Yes. First of all, is that...
It's okay. She said that there's a painless lump in her left armpit. So usually armpit is a representative area, and that's a lymph gland. It's a gland actually. It is not related to breast if it is exactly in her armpit. So lymph glands are the glands which gets the infection from here and there, where it drains, and the body immunity acts against it to cure it.
So what would you advise for someone like Florence?
For her, first she has to, if it is not the breast proper, and if she has just the left armpit glands involved, she has to concentrate on both her breast and also her arms, because even a mild infection or skin rashes in her arms can have glands enlarged in her left armpit.
Okay.
So it is not the breast issue, it's the general issue where the glands gets involved because of infection, or it can be any reason, any other reason too.
Okay, so her treatment would be different?
Yes, it's partially it can be breast problem, or it can be partially some other skin rashes or skin issues or some other infections. It can be of 50% of this kind or 50% of the other kind.
Okay, let's head back to the conversation of breast cancer. Do all situations, do all individuals, especially women, have to lose their breasts?
No, this is a wrong conception, and 10 years back, a decade back, there was something like any patient who comes with breast cancer, we go ahead with chopping off her breast and it's mutilating surgery. So nowadays, the advancement has come to such an extent, there is no need to lose her breast if it is a breast cancer of early stage. That's more important.
I like you said if it's an early stage.
Early stage, that's more important, because previously there was no staging like 0. Now there's a staging called stage 0. That means the earliest breast lesion, where we just go and remove the lump, and it's a different modality of treatment. Like a team of member treats the breast cancer. It's not only the surgeon treats the breast cancer, and there are various steps she has to go ahead, and it's not like a fever where she takes some tablets and she gets rid of the issue.
All right, so for someone who has already lost their breast to cancer, is there a natural way or that the breast can gain back or regain itself?
Yes.
And has this been seen?
Okay. After we remove the breast, there is nothing called as the breast can regrow. But what we do during surgery is we reconstruct the breast as if she gets her natural contour using some other muscles which is nearby, and if the patient is not willing, or if we are not able to do that, we go ahead with some artificial reconstruction so that they regain the contour of the breast, and also we create some new nipples. So there's something called as breast reconstruction.
Oh wow.
So it will look it won't be like 100% she'll have that thing, but at least 95 to 96% she will never feel that she had lost her breast. We can reconstruct the breast to such an extent it resembles the normal breast.
All right, are there methods of preventing breast cancer?
Yeah, first and foremost is we have to avoid the risk factors, like age cannot be avoided for sure, but things like smoking, alcohol. The most important thing is obesity, and other things like using oral contraceptive pills. So oral contraceptive pills has got some issues, like it's a risk factor for breast cancer. So all these things can be avoided, and genetic factors, age, female sex, all these things are irreversible factors. You cannot change all those things, but factors like avoiding smoking, avoiding alcohol, and if there is a family member, just try to take some precautions, like do not take contraceptive pills. So all these things can be avoided. Other factors which cannot be avoided, we cannot do anything for that.
All right, Dr. Perhaps maybe our last question to close off the conversation. We've talked about the different stages. You talked about a triple stage. Nevertheless, could you take us through how cancer breast is staged?
Okay. Depending upon the size, and someone was talking about her arm, lump in the armpit, so the gland involvement and the distance spread. So it is staged from 0 to 4. Previously, the stage 0 was not there, and now it's like 0, 1, 2, 3, and 4. So when we take 0 as stage, it has got excellent prognosis, and the patient will never feel that when she undergoes the proper treatment and the proper stages of treatment, she will never feel that she has lost her breast, and she will be perfectly fine after the treatment. And the prognosis is excellent. I can say 10 years survival is 98 to 99%. That means out of 100 patients, if they have 0 stage, 98 patients will live for more than 10 years.
All right.
And stage 4, it's last stage, and still the prognosis is very good, around 25 to 28%.
All right, so I have Kevin Ocheng. Kevin Ocheng, you're calling in from Nairobi, within Nairobi rather. Kevin, good morning. Thank you for watching KTN News. What's your comment to the conversation or contribution?
Asante sana kwa kunipea nafasi kuongea. Nilikuwa na swali. Kwa nauliza.
Yes.
Nilikuwa tu na swali yangu juu nilikuwa na pengine.
Ulikuwa na?
Shida. Yani ukiwa na source kwa private part. Na ikiwa ziko white. But they are painless.
Okay.
Na nimeenda kwa testing ya STI. Na hakuna shida yoyote.
Okay. Hiyo shida ni lump?
Sorry?
Ni lump?
No, nasema tu iko kwa private part. Na they are white.
Okay.
But they are painless.
All right, thank you. Let me direct that to the doctor. So, doctor, okay, for him, it's not an issue of a breast lump, but just being a general doctor, what is causing Kevin's problem? He says that for him, it's an issue within his private area. It's a white liquid, if I'm not wrong, and it's not painless. What do you make of it?
For males, I think he is a male, and if he says that there's some swelling in his private part, so it can be. If it is painless, it has to, most commonly it is like a hydrocele or a hernia. So it is absolutely different from what we talk, but still he has to seek medical attention, and very less chances for medical management. That means management by the drugs, medicines. It should be a surgical problem. Better he can consult a doctor. That will be better. All
right, Dr. The last question, and this one is coming from a viewer. Is it true eggs cause cancer in men?
Eggs? You mean eggs?
Eggs.
No. There's no relation between a male cancer breast with diet. It's related to the BMI, that is obesity. And male are more prone for breast cancer. It's 1% of the male in the whole population are more prone for breast cancer, and it's mostly genetic.
Okay. Mostly genetic. So eggs, no.
No.
All right. Thank you so much, Dr. Varun, for coming in this morning. Looking forward to having you again and really helping us understand this.
Thank you, KTN News, and thank you all.
All right. So that was Dr. Varun. He is a general surgeon. Today, our main focus was on breast lumps. We're going to take a quick short commercial break. When we come back, we'll dive into stories making headlines on the international front. Stay with Weekend Express. And that's it. That was it. That was fantastic.